I shared with a family member sometimes back, they were going to pitch for their company. And they told me one of the big questions I have to answer is, there are so many such companies providing the same service you're providing. So what are you to tell us? What is peculiar to you? And I told them, from the surgeon's wisdom, our mantra is simple. When you have a disease that has got so many ways of treating, it means the gold standard treatment has not been found. Otherwise, we will withdraw all these others and focus on that. Yeah. And she went and told them that. Like, she told them, when you find so many companies fighting for the same space to offer the same, it means there is something one company needs to get right, and then it will obviate the need for several competitors. So I feel like...
Ladies and gentlemen, welcome again to our conversation today. I have another pleasure of having a conversation with my senior colleague, Dr. Stanley Aruyaru. Karibu sana, Daktari.
Thank you, Chepsi. It's a pleasure to be here.
Asante. Last time, it was a few years back, right? In another place, we had a different conversation. But here we are again, talking about something wonderful, something beautiful, a masterpiece that you have put in form of a book, the second book, right? So before he speaks, I just want to note that I read the first book, The Chronicles of a Village Surgeon, and that was another masterpiece. And one of the stories was about the appendix. I still remember. In this book, he's talking about the gallbladder, and we'll talk about those things. Karibu Daktari. I've already mentioned your name, Dr. Stanley Aruyaru. What do you do?
Thank you so much. I think you asked that question severally. I am a consultant surgeon, and I currently practice as the Chief Medical Officer in PCA Kikuyu Hospital, which is a faith-based level 5 facility in Kenya. But outside of the day-to-day work, I also run the Secretariat of the Surgical Society of Kenya as the Secretary General, SSK as the Secretary General. And I am, God willing, finalizing my PhD studies from the University of Cape Town in global surgery. Yeah. So in a nutshell, that is me in the public facing. The private facing, I write, and I am dad and husband at home.
Wow.
Yes.
Wonderful. So, was it? Did you do the 844 or the 644 something?
I did the 844.
844.
The other one, I don't remember what it was called. Before
So,
CBC.
yeah.
Mm.
8 years in primary school, 4
Yes.
years high school,
6 years medical
6
school.
years medical school, internship
1 year.
postgraduate training
4 years.
4 years,
And
and
2
again
years
you're
before specialization.
man, and you're still studying. You don't get tired.
No, you don't, because if you stop to learn, then you stop to live. Really, that's the reality of life. I think the more you know how much you don't know.
Yes.
And the more you are not ashamed to say, I don't know. Yeah, so sometimes it becomes too much. But I think after residency, I also decided to make myself not make learning life and death situations. Residency can make learning look like life and death, but afterwards, then you know what can you balance. Yeah, so day-to-day work is learning, really, if you look at it that way, even if you're not in the formal learning. That is why there is experience, ground experience, how you handle the situation, how processes operate in an institution where you work, how the finance process or the procurement process or the public relations process or human resource process. It's just immense amount of work that you can study if you just suspend surgery for some time. So I could feel like, for the time I've been in administration in the C-suite, I have learned a lot that probably I cannot produce an MBA certificate. But learning goes on, whether it's formal or not. The moment you have that mindset, I feel like you keep growing and you keep getting better, even in what you've already learned and accrued certificates in.
Yes.
And congratulations to you too. You're also back in school, I know.
Yeah, I'm back in school, but let's set that aside for now. Um, Still about learning. So you've practiced both as a surgeon before you got into management.
Yes.
What have you seen differently from the time you were just ward surgeon and now you are in the C-suite?
Absolutely. Indeed, President Obama captures that in most of his speeches, and it's in his memoirs, that the higher you go, the more you have a bigger perspective of the interest of the challenges that come to you. And then you realize, oh, it's not just surgery, there is medicine and pediatric and other disciplines too. It's not just the ward and the theater, there is the lab too. It's not just the clinical side, there is the human resource too, and there is the creditors that have to be paid, and there is the legal statutory requirements. So I feel if I can summarize what being in the C-suite or in administration has taught me, is to know that there are so many moving parts in the surgical service, as it were, that now I don't have the managerial blind spot, that I can quickly know if I need an item right now, I quickly know this item is likely to cost this. But if it's a capital item and it was not in the budget, then you have to quickly sneak it in the budget making process, which means then you have to think back from the beginning of the financial year 4 months earlier, because that's the process probably the institution is going through to put things into the budget. Then you have to understand why, if you have 3 things that you want and you haven't generated enough revenue to give them, then where do you get the money to pay the worker or pay the staff and get the capital investment to buy this item? And then you quickly have to know what are the laid down structural processes that need to be cleared, so that then you are not flagged for audit queries. So then you quickly learn to know, okay, if I need anything above this amount, I must go to senior management. If I need something above this amount, I must go to the board. For me to go to the board, I need to give them a notice that is this period of time. And therefore, the next board that is coming is 2 weeks down the line. So I need to do a lot of things this week so that by that time we are ready. So all those things I usually did not know. And I know that can speak to many of the surgeons probably who have not sit in the administrative positions. And sometimes they look at you and they say, don't you see? Don't you understand? You just talk, you just look like one of them. But usually when you go there are a lot of information that you are private to, that also probably that person is not private to. And most of that information probably maybe is not for consumption by the front line or the mid-level management, is probably for consumption by very select people. You look at how the accounts are looking and you're like, today with 10 million and demands of that million to run for this week, how do I go around it? So you just make things that make sense. I think if I can put it in the nutshell, is just to learn that once you are there, just do what is important for the institution at that point. It might be not the most popular with the surgeon, it might not be the most popular with the administrative staff, but that is, in that moment, that is what is most important for the institution. That is what summarizes it.
So, briefly, now that you know more, they say that sometimes knowing more brings frustration. Now that you know more about the general hospital operation, are you a less frustrated surgeon or a more frustrated surgeon?
It's an interesting conversation. It's not a constant. It goes in peaks and dips. So if you do everything and you come in and you suddenly are surprised that this consumable is not there, but you've put the policy in place, you've put the checks to ensure that you have an alert anytime you reach a critical stock level, and then you come and that item is not there, you get an element of frustration, because you know, I have done so much. I have done so much towards making sure that no one goes through what I'm going through. So that is one. The other thing that frustrates you is you probably want to initiate something new, be it process innovation or process improvement, and you rally the team through. But then there's this constant feeling that you have to shout yourself hoarse, for lack of a better word, for the same thing that seems almost always easy and straightforward to you. But to the other person, you have to constantly keep telling them, remember, we said when we have this, we do this. When you have this, we do this. So there's an element of frustration when you feel like, I have done so much, how come that I don't see the results? But then you get comforted by the words of Gido Muigai, the former AG, said, you know, a state, and I think a parastatal and a big organization is not a speedboat, it's an aircraft carrier. it turns 1 degree per day. By the time it turns 360 degrees is a whole year. So you learn that because you also know if you look downstream, if you get just one item done right, if someone comes to undo it, they will struggle equally to undo it. So that gives you the comfort that once the teams are aligned, once the culture is aligned, once the process is okay, and it becomes second nature to the team, then you also know they will struggle so hard to flip it. So that aspect you can get frustrated. The other aspect is I might not get frustrated because then I'm informed. So when you're informed, sometimes also you're not frustrated because you know, okay, actually today I know we have this challenge because we didn't have this and this and the other, and therefore I expect these challenges. Guys, we are on it. It's okay. Let's put our best foot forward given the resources we have at the moment. There's always the imagination that, oh, if you go to hospital H or hospital K, everything is streamlined, everything is flawless. And for those of us who have also been to those hospital H and K, then you know I have been there. It was never flawless, but what comes from outside looks flawless. But I think in a nutshell, it depends on the scenario. There is an element of frustration when you're being caught off guard, but there's also an element of having a lot of information. And sometimes you feel like you are boring saying the same to people. If you have a workforce of 600 and you say to chunks of 100, by the time you are saying it the fourth time, you're like, this is so boring. Why am I even repeating this? It's already done and dusted. But as our professor used to tell us, communication is just like, watering plants. It's better to water them more than less. So you better err on saying it more over and over until it becomes second nature. Yes.
So, looking at what you're saying, and from what I know you, you are quite a busy person. A surgeon, a C-suite executive, and a family man. When I'm reading your book, and even the first book, I see that it gives a picture of somebody who is well read, not just in the medical stuff, but in other books like personal development books. Where do you get the time? You are in the ward, you are in the office, you have a family, you're doing a PhD. Where do you get time to read the Quran? For example, I came across a quote from the Quran.
Well, the good thing is that nowadays the traditional book, as it were, has been liberalized. So you can listen to an audio book when you're stuck in traffic. In fact, I remember when I was in Meru, one of the things I remember my commutes, despite having been a geographical bachelor every 5 days of the week, it's the commute of three hours driving and how much knowledge I could imbibe by just listening to an audiobook or a podcast. And sometimes I would just pull off the road emergently and stop and take note of that comment because I was like, that's something phenomenal. I need to document it and document where I heard it from. Otherwise, when I come back to listen, I don't know where I will pick it. But really what happens is at least I have a book in the car. I have a book at my bedside in the bedroom, and I have 3 books in my office, and I have a book in the locker in the theater. So anytime I have some time to do nothing, I can read a page. Every time I have some minutes where I'm stuck and the meeting is late to start, I can read something, and that for me has created an element of calm because I love to observe time. So when maybe some people are running late for a meeting or an engagement, or it's taking long before the next patient can come, I can try and read a page. And whether I'm reading the page in a physical book, whether I'm listening to an audio book, whether I'm reading a digital book, then that kind of brings it together. I suffer this problem of just getting books and shelving there. So in my small library in the house, there is a section with books that I'm yet to read. So I usually look at it and get depressed a little because I want to read them quickly and move on. But you move at the pace that you have a list, and once in a while you get a burst and say, okay, now I want to finish these 2 pages of this book. Or sometimes you get insomnia. You wake up very early, or you just can't fall asleep, then a book becomes a good thing to deal with. Yeah, but the traffic jams and the commutes really did me good from that aspect. And at the moment now I have to find a footing, but I am one person who some days, if I just leave office feeling tired and I just want to refresh, I might want to say, you know what, let me take a road, just go around Karen and turn around. By the time I'm coming back to Kikuyu, I've listened to 30 minutes worth of podcast. And from there, it will refer me to a book and refer me to a concept. Sometimes I do that. Not all the time, but sometimes I do that. Yes.
I think what I'm getting from that is like you have developed quite a unique habit. Maybe it's generational because if I can ask the Gen Zs, they might not relate with that much. For our younger brothers, they might be relaxation, watch a movie, or play some loud music. I am painting a bad picture about them. Sorry, but it's just generalizing for now. Yes, but that is something we can pick since this book, Bled Wisdom, a surgeon's guide to life beyond the theater. So when I read every chapter, I'm seeing you're starting with hospital experience. Then somewhere in the middle, almost every chapter, there's a transition, and then now the lesson. How come that, when we are in the hospital, we will think that we are only learning about the disease? How come that in the hospital we are getting life lessons?
Indeed. When you read the introduction of the book, what I call the idiosyncrasy of neatness,
Yes.
is you find a certain nuanced way in which surgeons behave. This was really what triggered the thinking about this book. But the initial trigger, as I mentioned in the launch of my first book, was actually the lesson from the appendix.
Yes.
And when I tried to extrapolate the lesson from the appendix, I found other things that are not important to you, but they can actually put your life at risk. I found peer pressure. I found difficult friendships. I found parasitic families and relatives, all those kind of things where you feel, do I really want to keep this friend? What my wife calls walking on eggshells. Yeah. Do I want to keep friends if I have to walk on eggshells next time I'm around them? They're behaving like an appendix or like the gallbladder. But besides the gallbladder and the appendix, I just also looked at the things we do and how I used, before I became a surgeon, I used to look at surgery as this awestruck kind of conclave of things and people and processes that someone outside doesn't know. And then little by little, you become a medical officer, and there's still that aura that until we have the surgeon, this we don't even know. And then over time, you get the initiation. So the first 2 days, the first 2 years, rather, everything looks, what is this? What is this? Then over time, it becomes normal to you. And I realized that also when I came into the C-suite, because everything was new, everything was a stressor. And then over time, now I am calm. Now I'm a little comfortable because of years of experience. And I felt, what are those things that nobody outside of the theater and surgical wing actually even knows exist, and how can they apply them? And that is what sets the tone, really the idiosyncrasy of neatness. So when you see someone who is very neat, well dressed, very quick in their decision making, very quick in their maybe articulation, if you quickly want to place them in the medical field, and say, this guy looks like surgeon, very quick steps, doesn't want to waste time, doesn't speak a lot, except me. Yes, doesn't speak a lot. So there are those things that they have probably just grown into because they came as personalities, but also because that's what they have found. Why are you talking a lot? Cut, operate, something like that. Yeah, so I was surprised that there's a lot of lesson to be learned. And I think really that is, even for me, to learn that I could look at life that way has been phenomenal and revealing for me. Because then I can ask, okay, what is the transferable skill? What is the transferable first principle that I can pick from this and share it to another person? I shared with a family member sometimes back, they were going to pitch for their company. And they told me, one of the big questions I have to answer is, there are so many such companies providing the same service you're providing. So what are you to tell us? What is peculiar to you? And I told them, from the surgeon's wisdom, our mantra is simple. When you have a disease that has got so many ways of treating, it means the gold standard treatment has not been found. Otherwise, we will withdraw all these others and focus on that.
Yeah.
And she went and told them that. Like, she told them, when you find so many companies fighting for the same space to offer the same, it means there is something one company needs to get right, and then it will obviate the need for several competitors. So I feel like, really, when you look at the life in that lens, you will always find it could be applicable. Yeah, and I guess it can apply in other areas also. But now that I'm a surgeon, I can only speak from a surgeon's perspective.
Fantastic. Let's talk about the gallbladder experience.
Yes.
You've talked. In the first book, you talked more about the appendix.
Yes.
This time, you've talked about the gallbladder.
Yes.
And in both of these cases, these organs, at least I'm in the medical field, I know,
Yes.
but other people might not know.
Mm.
The gallbladder has some function, but it's a function that you can live without. Let's talk about the biological function and now in the context of life.
The context of life. So the gallbladder, like I described, is an organ. It has its function. It just lies from the undersurface of the liver, the right side of the liver, almost actually at the center. And then it will receive bile. Once bile has been produced from the liver, it goes down, settles in the gallbladder, and remains there.
For the people, the bile is that green thing.
The green thing
The green
is supposed to come down
Yes.
and digest food.
When you slaughter a chicken, you see the green pocket. I want people to know what we're talking about. When you slaughter a chicken, there's that green thing that is very bitter if it spills over the whole meat.
Yes.
That is the gallbladder.
Yes, bile is something bitter. Bile is something bitter, not the gizzard, the bile. Yeah, so the bile then, once the bile is produced in the liver, it comes down, it has to be concentrated. It just holds like an oxbow leg. And then once someone feeds, then the gallbladder pushes that bile down into the intestine so that it can start the process of digestion. Yeah. But one of the things that can happen is that the longer, because of various biological mechanisms, but the longer the bile stays, this aspect of concentrating and maybe the top part is what is pouring and this little part is remaining, it can actually sediment. Mm-hmm. And one of the things that happens is once it sediments over time and gets very concentrated, then it can start forming gravel. You can imagine if you have a tea that is very sugary and very hot, you can stir the sugar and the whole sugar will dissolve into the hot tea. But if you left that hot tea in the fridge, when you pick it in the morning, sugar will be sedimented at the base. So usually that bile can have some sediments at the base that contribute to stones. And once someone has developed the stones, they have their own cascade of problems. They can cause the pain by themselves. They can go down the channels and block them. They can go down all the way to the area called the pancreas and block its entry and cause pancreatitis. They can get the gallbladder blocked and infected, and it can create sepsis. It can create so many complications. Those in surgery understand them better. So the case I share is the case of a lady, diabetic hypertensive, who comes during the COVID period, and we remove her gallbladder. But actually, we wait for the infection to settle down, then we remove the gallbladder. But then she has a collection of bile there, which is one of the complications you can get. Once you remove the gallbladder, because it's next to the liver, if it's very stuck to the liver, there can be a little oozing there. And you expect that where you removed it, you can collect some blood. That blood can get infected. So that's what happened to this lady. She comes back. We have to look through, and the match we see is because there's just infection below the liver on the lower side, there's also infection above the liver on the side of the chest. So the match we see when we examine her and look at the scans is that she has fluid in the right side of her chest. We remove it, we treat it, we treat her, we investigate her for COVID because it was COVID time, and we treat her, she goes home, she comes again. And like, it doesn't make sense. She still has tachycardia, respect tachycardia. She comes back again. She still has a high heart rate. And then I get a second opinion scanner, and my colleague, the radiologist, tells me, it is just where you remove the gallbladder. There's a little blood clot that accumulated. It's gotten infected. And or there was a little small venue of bile that leaked a little, and then everything is okay, but that fluid is there. So the moment we remove that, everything is okay. But remember, she has been to the hospital 3 times. She has had a chest tube. She has had major surgery, and she's diabetic hypertensive. And I don't even want to go to the extent of others that probably even have gone significant complications from the surgery or died or something like that. And then you ask yourself, but wait a second, but we removed the gallbladder and she's okay. So why was it causing us such problem? Anyway, of course, the thing is, out of 100 people, maybe in their lifetime, only 10 will get a gallbladder stone. So if you go to the market and scan 100 people, you might find 10 of them have gallstones, but they don't cause them symptoms. And out of this 10, then maybe another 1 or 2 will develop symptoms over time. So we don't go plucking gallbladder, but it keeps teaching us a lesson that, oh, it's there, it doesn't really do so much, you can do away with it. It's the nature of redundancy. God gives us all the redundancies. One can live without a kidney, but we have two, because it's redundancy along life, so that the more you age, the more you are clearing the redundancies, and probably as your organs are functioning less and less and less, you still have enough to take you through your lifespan. Yeah, so that is an experience that each one of us can share and wonder, so who is the gallbladder in my life? And then decide, you don't have to remove gallbladder when it's normal, but you decide when they get sick.
When they start causing problems.
When they are causing you problem, you dispense with them so that then you are alive. Otherwise, if you keep it, then it puts your life at risk. And doesn't mean just because it is putting your life at risk, it is so important for you. It's actually something you can say, can I live without it? You don't have to.
You've had such experience, the gallbladder experience in your personal life.
In my life, yes, I have. And I share an example. Of a colleague, very well established. Doctors and especially surgeons are type A personalities, go-getter, everything.
Yeah.
So this colleague, who every time I talk to, they will always say, you're in the C-suite. You shouldn't be in private practice. People are making money out here. Or the other time I see them when I'm not in the C-suite, like, man, you should be the CEO. That CEO knows nothing, but he gets all the money, and you are here slaving. I'm like, my friend, you don't have anything positive. You don't have anything positive you can tell me. So that is one thing about maybe a colleague, and I mentioned that because I share it in the book. But each one of us can think about the family, and especially for those of us who come from the village. The town has become so liberalized, and we don't have the childhood memories here. But when you go to the village, you have all the memories, and you have all these good friends. You form the community together. But there are also those who come and gossip, and they come to spoil your day, and you're like, for this time around, I don't need this. For this time around, I don't need you. So I don't write to say that you should excommunicate your friends, but you can actually titrate how much time you give them when you have the energy. There's a time that all you need is an encouraging word.
Yes.
You don't need a pessimist. Those times are not the time to go to the gallbladder friends or gallbladder relatives. Those are the times to say, I just want to talk to people who will really cheer me on and support me going forward. If you then have the energy, then you can say, okay, you beat me up. I'm okay. I can take it today. And you can give them that. And I share the example that is shared by Jay Shetty. You've read Jay Shetty, Think Like a Monk, and also listened to his podcast On Purpose. And one of the areas he speaks about a 75-25 allocation.
Yes.
You can decide 25% of the time I will allocate to the friend who is a gallbladder or the relative who is a gallbladder. The other 75% I will give to the others so that you still have the energy. Yes, indeed. Yeah, and that happens a lot. When you look at it in that perspective, you can say gallbladder, appendix. And when the season is ripe, say, okay, today I can meet my gallbladder friend. When the season is not ripe, like today I really don't have the energy, the goodwill has been exhausted. Let me just hide and retreat, or meet someone who will tell me, okay, you got this.
Fantastic. As we finish on that, and maybe if I can add, just like you cannot remove your own gallbladder, you need a surgeon to remove it.
Yes.
In real life, if you are struggling and you are not able to identify the gallbladder, it is okay to find somebody to help you identify what is getting you down. Yes.